The United Arab Emirates has witnessed an unprecedented growth and excellence in every sphere of its activity. Its vision is to create a dynamic, healthy society where everyone benefits from and contributes to a true sense of well-being and that fosters sustainable social and economic prosperity. Good health is vital to a nation, the development and prosperity for its present and future generations. Among several frequently occurring health concerns, genetic diseases are a cause of immense concern, as they can be passed through parents and inherited as traits or carriers, which can become a major health risk for future generations. Such disorders are widely prevalent around the world, and the UAE is no exception to such genetic disorder diseases in its population. Her Excellency, Dr. Mariam Matta, a distinguished UAE national and a physician, pursued the Sheikh Mohammed Leadership Development Programme, opting for a community project on thalassemia, the most common inherited blood disease among other genetic diseases prevalent in the UAE. Her efforts in this direction led to the legislation in the UAE, with thalassemia screening mandatory in Premarital Investigation Bill passed in the year 2005. Dr. Mariam focused on the magnitude of the problem in the community by initiating a thalassemia screening program at the Dubai Women's Higher College of Technology. The analysis of this first UAE screening program, involving 1,114 students, was quite alarming, with nearly one-third identified as anemic. Subsequently, with the help of distinguished colleagues and a network of 13,000 volunteers, gave an overwhelming support to the program in less than 6 months. Tremendous encouragement and support came from His Excellency Sheikh Nahyan bin Mubarak Al Nahyan and other dignitaries in setting up the UAE Genetic Disease Association. Soon after, the United Arab Emirates Genetic Disease Association was established. The UAE GDA was born with a vision that strives to reduce the prevalence and impact of common genetic disorders in the UAE: beta thalassemia, alpha thalassemia, sickle cell anemia, hemoglobin D, hemoglobin E, hemoglobin leper, hemoglobin O Arab, G6PD deficiency, breast cancer, etc. Taking up the challenge of treating widely existing diverse types of genetic disorder traits among people in the UAE, the GDA began with a mission: to increase awareness, educate and motivate the population for screening for thalassemia and other genetic disorders and of public health importance in the UAE. To scientifically understand the facts and trends of selected genetic disorders in our community based on research and development. Following the example of Cyprus in achieving a thalassemia-free society in 10 years, the UAE GDA has also focused on achieving a challenging target: to make the UAE free from the births of children with thalassemia disease by the year 2012.
1 in 7 people in Cyprus, 1 in 10 Italians, 1 in 20 Asians, 1 in 50 Afro-Caribbeans, 1 in 6 in northern parts of India and West Pakistan, and studies indicate about 1 in 12 UAE nationals are beta thalassemia trait carriers, and about 8.5% of the world population, over 70 million, have beta thalassemia trait.
This child suffers from a unique genetic disorder that requires regular blood transfusions every 3 weeks. This starts from the age of about 6 months and continues for the rest of the life. He suffers from a genetic disorder called beta thalassemia major, which is a very serious blood disorder requiring regular monthly blood transfusions and expensive daily injections and medications for life. A child with such a disorder can only be born if both parents are carriers of thalassemia. Such carriers are completely healthy themselves, but they have a 25% chance in each and every pregnancy to have beta thalassemia major, a disease with severe anemia, sometimes also referred as Cooley's anemia or Mediterranean anemia. To be able to check this genetic disorder from being passed to the next generation, a thorough screening program must be followed. Screen blood for genetic disorder. Microsmart Systems, and in association with its strategic partner, Zircu International, has proudly donated a state-of-the-art database and laboratory information management system called Microlimbs and developed the UAE GDA website worth $1 million. This state-of-the-art fully automated laboratory application paves the roadmap to accreditation to the highest international standards, such as ISO 17025. With this system, automated workflow with highest confidentiality and security access of the clients is assured. The system integrated all the testing equipments directly to ensure profound efficiency, accuracy and speed of the test results with minimum dependence on staff interference. With Microlimbs, interested clients who want to participate in the screening process can register through the internet and receive the results through email. Awareness, screen, donate. Genetic disorders need people to be educated about it. Special blood tests for thalassemia can also be done at the specialized state-of-the-art laboratory at the UAE Genetic Diseases Association. The blood collection is effortless and a painless process. In the absence of such a screening and prevention program, children with beta thalassemia major continue to be born, resulting not only in family suffering, but also leads to a substantial strain on the financial resources of our nation. A simple comparison, the upkeep of every patient suffering from thalassemia major costs approximately 1.2 million dirhams, whereas to screen a simple test and the chance to save a life of an offspring suffering with this genetic disorder is just one premarital test.
السلام عليكم، أنا اسمي نورة من كلية تقنية دبي للبنات. أجريت حاليا فحص الثلاسيميا وهو فحص بسيط جدا لا يأخذ إلا ثواني. ونصيحة من إخواني الطالبات والطلاب أن يجرون الفحص لأنه فحص بسيط ما فيه أي ألم. توني استلمت النتيجة وكانت نورمال الحمد لله.
As witnessed in many Mediterranean countries like Cyprus and Sardinia, this national thalassemia screening program will help in drastically reducing the incidence of new births of children with the thalassemia disease. The UAE strives to follow the example of Sardinia, wherein not even one child with the thalassemia disease has been born in the last 2 decades. This step, educating our youth to take preventative measures, to be able to nurture a generation free of genetic disorder and to implement premarital or preconception screening for thalassemia and other genetic disorders. A simple awareness drive of thalassemia supported by people at large, encouraging healthy people to come forward and volunteer blood donation, helps to bring a qualitative improvement in the lives of many thalassemia patients in the nation. From 1,300 screenings in the year 2007, the UAE GDA targets 30,000 students by the year 2010. The number will keep progressing until every citizen is tested. The objective is meeting the challenge much before the proposed deadline of freeing the UAE from thalassemia by 2012. UAE GDA's dynamic achievements. Successful screening held for the first batch at the UAE University Medical College Al Ain, 25th April 2007. Successful screening for the first batch at Zayed University Abu Dhabi, 20th May 2007. Commencement of the screening program at the Dubai Women's College, Higher Colleges of Technology, 1st March 2007. Let us all come together. Let's screen and donate today.